Welcome, everyone. This is our 6th annual Geographic Education Week and OSM Awareness Week and OSM Geo Week. Today, we are here with Mark from Health Sites and Lamine from OpenStreetMap Senegal to talk more about building baseline health facility data with healthsites.io and OpenStreetMap. I'm going to pass it over to Mark now. Thanks for being with us.
Thank you, Rachel. So my name is Mark Herringer. I run the Health Sites project. We've piloted the work that we've been doing with Digital Square in Senegal last year with Lamine and his team from OpenStreetMap Senegal. And we're looking forward to showing you a human-centered design approach that we're taking to drive the development of the data today. Over to you, Lamine.
Thanks, Mark. Hello, everyone. My name is Mohamed Lamine from OpenStreetMap Senegal. It's a pleasure to join the groups and to discuss with health facilities. Thanks.
Okay. So our goal is to establish an accurate baseline of health facility data in OpenStreetMap. And we've got key activities that our project focuses on, which focus in on enabling stakeholders to get health facility data into OpenStreetMap, connecting national health agencies with volunteer communities, and bringing in different data sets to build higher data quality. And then finally, looking at the user stories of people on the ground and making that methodology basically approachable and simple to use. So I'm hoping that I'm going to be able to show you that methodology today in a way which you can start writing down on Post-it notes. So essentially, this is the end product that we've achieved, and this is how we improve baseline health facility data to OpenStreetMap. We use OpenStreetMap as the data store. So when someone opens up a health facility on Health Sites and logs in with their OpenStreetMap account, they're able to take advantage of the tagging structure of OpenStreetMap to build a baseline of health facility data. And that has tremendous implications when it comes to interoperability between stakeholders. Because we're using OpenStreetMap as the data store, and others in missing maps and in the humanitarian sector are doing the same, everyone has access to the same data. And that's a really powerful thing. So today I'm going to just talk about how do we drive the development of the data. So, you know, we've got a variety of tags, but which ones are the most important to focus on first? And so our strategy is to identify emergency health user stories that mean something to people in places where the data is poor. And if any of you have ever done a Post-it note exercise to define user stories for software development, this is the same sort of process. You all contribute your stories, and then you look at them together and you identify the ones that you think are the most important. And as you can see in this diagram, people have put their votes in the form of the red dots next to the stories that they feel are the most important. So, okay, so taking a step back, the history of our project started during the Ebola outbreak in West Africa. The ICRC funded us after that because they were interested in understanding what the baseline of health facility data is when they go into a conflict zone. Then in 2018, Digital Square funded us to establish OpenStreetMap as the data store. And most recently, Lamine and the team in Senegal have been updating emergency health data with support from the Hot Micro grant. So if you look at the Paris 21 objective to achieve national and international development goals and reduce poverty in low and middle income countries, this is a something which is easier said than done. And an OpenStreetMap is one of the tools at our disposal, which is being used by academic institutions to address and understand how best to tackle this problem. And so we have an approach that we're working towards, which is to establish this interoperability between the National Statistics Office, the Ministry of Health, and OpenStreetMap. So the opportunity with OpenStreetMap is that your baseline health facility data can be shared by the Ministry of Health into OpenStreetMap, and the National Statistics Office can use the same data set. So that means that everyone is on the same playing field and using the same data. And then from there, your National Statistics Office can publish statistics on maternal mortality rates, road accidents, disease outbreak events. So your emergency health user stories, essentially. And the stakeholders in the health cluster then have the opportunity to collaborate together using a common baseline and the statistics of the National Statistics Office to improve the numbers, essentially. And so this is a strategy that we are working on, and we feel that OpenStreetMap provides this really important interoperability. Okay, Lamine, I'm going to hand over to you there. If you want to just give an update on the work that we did in Senegal last year.
Okay.
And if you want to speak in French or in English, it's up to you.
Okay, I go to speak in French. En fait, merci Marc pour l'opportunité et que vous nous donnez de parler en fait du travail qui a été fait. Donc, comme Marc l'a bien dit, donc durant l'année passée, on a pu faire une cartographie de collecte en fait dans le cadre du projet HealthSide, donc au niveau de Saint-Louis. Et à partir de ce moment, on est revenu à Dakar, donc le 24 juillet, pour faire une présentation en fait des travaux au niveau du bureau de la direction des statistiques, donc du docteur Youssouf Ndiaye, donc au niveau du ministère de la Santé. Donc, pour un peu expliquer le contexte du projet. Next slide, please. Et tout ça est parti en fait d'une collaboration qu'il y a eu grâce à l'appui en fait du Digital Square, mais aussi avec un partenariat qu'on a noué entre OpenStreetMap Senegal, HealthSide, Geomatica et Carto ONG. Et pendant ce processus de collecte, on a pu en fait identifier tout ce qui est acteur au niveau des données sanitaires, et on s'est réunis au niveau des bureaux de OCHA pour pouvoir faire en fait une évaluation de la collecte de données. Donc une fois sur le haut du terrain, on a pu présenter les résultats aux différents partenaires pour leur montrer un peu l'étendue de la collecte. Next slide.
Okay. Thank you, Lamine.
Thanks.
My French needs to improve, and it will. I assure you, it will. Okay, so this is the strategy that we're taking. We're defining an open data standard with OpenStreetMap, which is a vibrant community of citizen science activists, and that data then is being published through our front end, which is an open source platform hosted on GitHub. And then we're looking to drive the development of the data, as I was saying earlier, with human-centered design, and to improve those numbers iteratively. So when we think about the standard, this is what we're talking about. We're trying to understand how to support emergency health with the tags that OpenStreetMap offers. And as you can see, we can specify blood checks, medical physics, radiology with the speciality of a healthcare. We can indicate the name of the facility, operator types, the contact information, the staff count, whether or not it's wheelchair friendly, if there's an emergency facility, and what the nature of the electricity supply is. So Our focus on emergency health data has come as a result of collaboration with the Kemri Wellcome Trust, who a couple of years back published a database of health facilities in collaboration with WHO, where they said, look, we've developed this database, and within the database, we've got in the region of 5,000 public hospitals, but we can't tell you what the definition of the services in those hospitals are, and that should be the priority. The definition of the scope, service provision capacities, laboratory capacities, and optimal catchment populations for emergency hospital care should be a priority. And this is what we've taken on, and essentially we're trying to stand on their shoulders and add value. And this is where OpenStreetMap has the power to offer this accuracy of data, because it's an open data license. So if we look at the priority user stories, we can begin to identify the following primary areas: epidemic preparedness, immunization programs, health capacity planning, support for social entrepreneurs, maternity care, and disaster response. So broadly speaking, those are the areas that we've focused in on. And in the emergency context, we could write a story in the form of, as a pregnant mom preparing for birth, I would like to visit a facility with an ultrasound to check on the health of my baby. So this is the structure that I'm going to communicate to you in the next few slides. And it allows us to identify which attributes in the OpenStreetMap baseline health facility standard we should focus on. So getting back to our user story, as something, your persona, I would like to, so that I can. So that's the structure that we write our stories in. And if we take that structure forward for a pregnant mother, and I've just been through this process with my partner, and so these stories are very close to me. So we can say, as a pregnant mom, I would like to know if a facility has a well-staffed surgery should I need a C-section. Okay. As a pregnant mom preparing for birth, I would like to visit a facility with an ultrasound so that I can give my baby the best care possible. So, when you're pregnant and you're going through this process of having an ultrasound and a specialist look at the health of your baby and assure you that everything is looking great was a fantastic thing for us. And in addition to that, knowing where an emergency service was, should we really need these services, was also very reassuring. So then if we go to the next section on, or the next persona rather, in the form of an epidemiologist, your stories look like the following. As an epidemiologist, I want to know where the diagnostic services are so that I can perform clinical pathology and sample analysis. And as an epidemiologist, I want to know the number of doctors and nurses at a health facility so that I can assess the capacity to manage a disease outbreak event. So this last story in particular is one that academic institutions and stakeholders in the health cluster are particularly interested in, because it crosses boundaries. You're talking about regions in Central Africa rather than provinces within countries. So you're crossing boundaries, and therefore having the data in a common standard that crosses boundaries allows one to assess the risk of a disease outbreak event, because you can see what the staff complement is in facilities on either side of the border. And the data is accessible rather than having to try and get access through each Ministry of Health. So then finally, a road accident. As a citizen responding to a road accident, I want to know where the nearest emergency facility is so that I can get there quickly. So this is it's a relatively loose story, but essentially it describes the attributes that we're interested in, and it begins to identify who, what, and why. So if we look at the three stories, we've now identified the attributes that fall into the what column: diagnostic services, number of doctors and nurses, a well-staffed surgery, an ultrasound, where the nearest emergency facility is. And as a result of these user stories and then the definition of the underlying attributes, we can now see in the OpenStreetMap baseline standard which attributes to focus in on, which ones we should be asking stakeholders in the health cluster to share with us so that we can improve the quality of the data. So we drive the development of the data with priority user stories. Okay, so essentially this is what it looks like for the ultrasound. And as I was saying, this is a story that I've recently been through and appreciated. Okay, so essentially there is the platform allowing a user to now improve this data by selecting diagnostic radiology. And we're trying to build a bridge between stakeholders in the health cluster and the medical profession and OpenStreetMap. So people who visit facilities and know which services are available are able to share this baseline health facility data openly in public. And once it becomes geospatially updated, we'll then be able to, organizations are able to use routing software to begin to show the nearest facility and what the quickest way to get there is. We all use these types of services to get to restaurants and what have you. And by the same method, one needs this geospatial data to optimize emergency healthcare. So knowing where the nearest facility is for a particular type of attribute is what we're providing. And in addition to that, we can generate isochrones, which show us the population that is most at risk when it comes to receiving this emergency healthcare, and when it comes to health capacity planning, or in terms of vaccination planning, trying to understand which populations need to be focused on. This is the technology that's being used at the moment to support people in need. And this is why we need to improve the quality of the data in OpenStreetMap now, so that the COVID response and other disease outbreak events that are happening can be supported. So here's just a reference to the Nature Medical Journal that recently published the global maps of travel time to health facilities. And OpenStreetMap data through the Health Sites API was used to determine these travel times. And it is a resource that is being used to establish this service and improve Sustainable Development Goal 3.8, access to health. Okay, so to get back to the sort of data silos that are around, here is a visualization done by AfriMapper, one of our project partners, that have basically pulled in the Khemri Wellcome Trust's data that they published in the database I referred to earlier, and compared it with new data that Lamine and the team in Senegal have recently collected. And you can see how different it is. And this is the data silo that we're essentially trying to update and remove. And here is the bed data. So like I was saying earlier, epidemiologists need to know the capacity of health facilities to respond to disease outbreak events, and the number of beds available in facilities is one of the ways that you do that. And this visualization by AfriMapper shows the bed data before 2020 and after. And as you can see, Lamin's team have created those circles in the left-hand diagram, which mean a lot to epidemiologists when they need to understand where the risk is, and how to manage a disease outbreak event. So that's pretty much the end of our presentation. Lamin, would you like to add anything before we close out? Okay, I think you're on mute still. All right, we're not hearing you, Lamin. Celine, do you have any questions for us?
No, it was very interesting. Thank you.
My pleasure. Lamin, would you like to add anything?
Ok, en fait, je voudrais juste remercier en fait Healthside pour la collaboration et l'ensemble des mappeurs donc de la communauté OpenStreetMap Sénégal qui nous ont permis un peu de collecter ces données sur l'ensemble du territoire national. C'est vrai que c'est un travail qui vient de débuter et on aimerait bien nouer des partenariats avec d'autres instituts pour pouvoir l'élargir sur l'ensemble du territoire national parce que sur des zones, on a eu de la bonne donnée comme à Saint-Louis, au niveau de Dakar. Maintenant, il reste l'intérieur du pays et on aimerait avoir des collaborations donc, avec d'autres partenaires pour pouvoir cartographier tout l'étendue du territoire. Et que ces données-là qu'on crée sont mises à la disposition en fait, des populations et des décideurs. On s'est rapproché du ministère de la Santé pour pouvoir les aider à avoir les données fiables, les données réelles sur la population, donc le nombre de médecins, le nombre d'infirmiers, le nombre de lits, donc quels sont les hôpitaux qui sont équipés d'ultrasons, quels sont les hôpitaux qui ont des IRM, quels sont les hôpitaux qui ont besoin d'être upgradés. Donc tout ça, on a travaillé pour pouvoir mettre à disposition ces données-là. Et on invite tout un chacun à se joindre à ce travail-là, que ce soit au niveau du Sénégal ou bien au niveau de la sous-région. Donc nous, on est disposés à venir partager cette expérience-là avec Marc et toute l'équipe donc derrière Healthside pour vous aider à faire une carte au niveau de votre pays. Merci beaucoup. Marc?
Thanks, Lamin. Okay, I can see Kuku has a hand up. Would you like to ask a question?
Okay, hello Mark, hello Lamin. I'm Koko from Togo, and we are thinking to do the same project here in Togo. I would like to ask Lamin. Lamin, do you have any documentation about the process you have made for the project? If yes, can you share it? And the second question is, do you ever think you can translate it? Because we have several countries who want to do the same project, but they don't know how to begin because all the documentation is in English and we are French country in CDAO.
Ok, merci beaucoup, Coucou. Donc, c'est vraiment un plaisir de te revoir, Ake. Et par rapport à la documentation, comme tu l'as dit, hein, c'est une documentation qui est en anglais, mais nous, on a pu avoir une documentation française, en fait. On a pris la documentation anglaise, on a traduit pour pouvoir faire les présentations au niveau de nos gouvernements. Donc, si vous voulez, nous, on peut partager ces documents-là avec vous. Et puis, n'hésitez pas, si vous avez besoin de quoi que ce soit pour pouvoir vous aider à traduire la documentation ou bien à vous aider à aller discuter avec vos dirigeants, n'hésitez pas. Nous, on est là pour ça. Déjà, on a eu pas mal de difficultés avec nos ministères pour pouvoir avoir une bonne introduction du projet. Donc, de cette expérience-là, on va essayer aussi de vous aider par rapport à comment faire les présentations, sur quel aspect s'appesantir pour éviter les refus. Donc, tout ça, on pourra discuter ensemble sur ces aspects-là. et vous dire qu'il y a une documentation bien en français, une documentation française qu'on pourrait partager avec vous. Il n'y a pas de souci. OK.
Okay, thank you.
Et l'autre aspect, c'était par rapport à quoi? Après la documentation, tu avais parlé de où commencer. Voilà. Bon, déjà, ce que je vous suggère, c'est de commencer par une district. Nous, c'est ce qu'on a fait. On a commencé par la cartographie du district. Donc, à savoir celle de Saint-Louis. Une fois maintenant ces données collectées et traitées, vous allez voir le ministère de la Santé, vous allez voir les acteurs humanitaires et vous leur faites une présentation de ce que vous avez fait comme travail. Et là, ils seront beaucoup plus intéressés pour voir le résultat et ils vont vouloir faire ça sur l'étendue du territoire national. C'est bon?
Ok, merci beaucoup. Je pense que je vais t'attraper en inbox. On va discuter après pour avoir les documentations et voir comment on peut travailler là-dessus. Merci
Il
beaucoup.
n'y a pas de souci, ce sera avec plaisir. Merci, Ake. Marc?
Thank you, Kuku. Thanks, Lamine. And yeah, I look forward to being in contact to support your campaign and learning French in the process. So does anyone else have any questions? Okay. All right. We're going to wrap it up then. Thank you very much for making the time to join the presentation today. And thank you for your questions. And yeah, please be in touch if we can offer any support or if you have any questions. Thank you very much. Bye-bye.
Thank you. Bye.
Ciao.